Good evening, everybody. I hope you all had a wonderful Easter with friends and relatives. I know I did, and it's coming to a close now this evening, and um, tomorrow starts our week, and we're going to begin week 6 tomorrow. And only a couple weeks left, and you're going to be done and through with the first portion of your training. On to the next portion. So let's get what we can out of it. I know you're all worried about this paper that's coming up, so I'm going to do some in-depth exploration of that. And the final review is going to be on the 17th at 7. And I am putting that together now. I really am praying hard that everyone is able to take that final without any issues this time. I know that it's such a stressor for you all to have to go through these trials, and so let's stay positive, um, be prepared, make sure that you go through everything to ensure that you're all set up. Okay, so make sure that everything is working, your microphone is working, make sure you're doing everything right. Uh, Not the day of the test. You need to be up on a few days prior. Okay. So I want you to work really hard on that. Okay? So let's see. Let's go back to our coursework here and go over the paper a little bit. And remember, when you're doing your case studies this week, I really want you to start using that SOAP format. That because that's something that you're going to begin really using as you move forward in the courses now. So you'll have a one up if you begin doing that. So remember, everything starts with your chief complaint. And that chief complaint is a very short, 1 to 2 words, a short sentence at the most that describes why the patient came to the clinic today. And that's how every note needs to be started. Okay, so, but let's get to the purpose here. All right, week 6. And let's get to the paper. The paper is going to be due on Sunday. And come on, computer. All right, there we go. So the community disease portfolio is essentially the continuation of the paper that you started in your last course. So the community disease portfolio, the first half covered the demographics, health ranking, causation, causative factors, and pathophysiologic development. So that was the first piece of it. And so in nursing 673, you examined these certain aspects, and in 674, this is a continuation. 6 to 8 pages. And I really think after looking through the requirements of the paper, you would be hard pressed to get it done in any less time. So, the criteria, you need to find 3 current and relevant research studies which examine the pathophysiologic basis for your health issue from community disease portfolio first half. And these need to be scholarly research studies. So essentially, what you're doing here is doing a mini literature review. So you're doing but instead of doing, when I did my literature review, I had to have 10. This is a mini one. You only need to have 3. Appraise the efforts made to complete these 3 studies. Compare and contrast. Integrate these findings to explain how they might affect the chosen health issue. Now you're going to switch gears here and go to the 3 current and relevant clinical practice guidelines. So you need to search for 3 clinical practice guidelines. So these are evidence-based. The best places to look are the CDC and professional organizations that represent the disease process that you're working on. So if you're doing something on infectious disease, the Infectious Disease Society of America is excellent. If you are doing something with OB or pregnant women or an STI, ACOG. So you want to, it's these professional organizations that actually develop the evidence-based practice guidelines that we use to practice in medicine. So I want you to go and look for those things and then critique the evidence on which each clinical practice guideline is based. So they just don't write these things, they use evidence to develop these things. And let's look at the rubric here. Remember, spelling and grammar, punctuation, and APA is very important. And sometimes I have people say to me, well, I'm not going to be writing papers forever. Why is this such an important piece? I'm going to be a nurse practitioner. I'm going to be seeing patients and identifying disease. And why do I need to learn how to write a paper? Well, writing a paper is incredibly important because it illustrates your ability to think critically. And it also demonstrates your ability to use logical reasoning to draw conclusions. So it is a very important piece. It's one of the reasons that many physicians you'll see have PhDs because they've gone back um, to do research studies. And you may not believe it now, but many of you will ultimately go in and get your doctorate degree when you're done here. And if you opt to do that, you need to know how to write a scholarly paper. You won't have any second chances in your doctorate program. And your doctorate professor doesn't care if you've always gotten an A in the past. They look at the rubric, they grade by the rubric, and if you don't have it there, they're going to mark you off for it. So I think it's really important to learn these key points as you are beginning this program so you can know what the expectations are as you move forward. So let's take a minute and look at this rubric here. All papers begin with an introduction. An introduction is an overview, purpose, and plan of your paper. So I don't want any material that isn't an overview of your paper in this area. So that introduction, and you never start a paper with the word introduction, this overview gives the reader an understanding of your paper. It's your purpose statement. Why are you writing this paper? In a paragraph, 2 at the most, but you can typically do this introduction in a paragraph. The next one, your next rubric is going to be related to the research studies that you're finding. So typically you'll write a heading and then you will write a small paragraph on what you're going to, what is going to be the outcome of this heading. So why are you writing this heading? What's it about? And then you can do a subheading. This is how I would write it anyway. A subheading with the first article, write on that. The second article, a subheading, write on that. The third article, write on that. Then you're going to do a new heading. And then you're going to examine each of the 3 research studies detailing the purpose, methodology, and findings. So write on that for each study. You could do a subheading on those also. Appraise the efforts, heading, and then you can do a subheading. You know, as you go through the rubric and you see that there are less things that need to be individually written for each, and it's totally up to you. You don't have to. I have written literature reviews where I have made the articles in a subheading. I've also written literature reviews where I have written it paragraph style and incorporated the research articles in the paragraph. So whichever way you choose to do it is fine. But I want to make sure that you are clearly documenting the headings so that the reader knows what, if you're answering those questions. That's what it's looking for. So ensure that you're doing that. Summary at the end, that's your conclusion. So write conclusion. I don't like the word summary. And then again, your references must be no more than 5 years old. That's the latest. They need to be scholarly. No dot com references will be allowed. Dot .org usually, yes. And anything from a professional organization, that's a yes too. And research articles are always good also. So, formatted in an APA, make sure that your cover page is correct. I've seen a lot of people not writing cover pages in a correct manner. So, make sure that that's done properly. If you have any questions, please reach out to me, and I'll be expecting to hear from you this week if you have any questions on the paper. And this is going to be your last discussion post this week. So, at least in this course, you always have discussion posts in all of these courses, so that's nothing out of the ordinary. But for the purposes of your pathophysiology, you're almost done. And I'm sure you're all like, I'm so excited, I can't wait. On to the next class, right? All right, so let's see. I want to go here. And we're going to look at our discussion questions this week 1, 2, and 3. Okay. So, again, as usual, you have until Wednesday to make that first posting. I really want you to try and put your note in a SOAP note format. Let's get started trying to do that. Some groups have had a little issues with the differentiation between subjective and objective. So I want you to start out with a CC. What's the chief complaint? The chief complaint directs the visit, and it encompasses 1 or 2 words that describes what brought that patient to the clinic to see you today. You expand on that in the HPI, the history of present illness. So in the history of present illness, you're going to illustrate that story a little bit. You're going to go more in depth in that story. And then we're going to go into history. So when you're doing history, you want to know if there are any past medical conditions, if the patient's immunization status is up to date. You want to know if the patient has any family history, any surgical history, what medications they take, allergies to any medication. You also want to know their social history. Do you smoke? Are you working right now? Do you have any how many alcoholic drinks do you have a week? Do you exercise? Now, these things typically, if they're a new patient, this is one of the reasons that new exams are billed at a higher level, because you spend more time getting all of this information and documenting all of this information in place. And that takes a longer time, so we can be billed at a higher level. If the patient's a returning patient, we're reviewing the information because things change. People go off of medication, they change medications, they have surgeries that we don't know about, they quit smoking. So we review it, but we aren't getting it. So it's a little, we bill at a lower level. So that encompasses the subjective piece. Now let's move on to the objective piece. The objective piece includes vital signs, height and weight, and anything that you see. Now you're going to do your physical examination. You're going to check the patient out from head to toe. Every body system needs to be covered. Now, what's the A? The A is the assessment. So when we are looking at the A in our SOAP note, we want to think, that's where our differentials go. Our differentials go there. And we also have to include rationale with our differentials. We just can't say we're choosing this one. No, we need to know why. We have to have a rationale behind why we're choosing that one. And then ultimately, what's the diagnosis that we have chosen? Now, okay, this is the diagnosis we've chosen. Now, what's our plan? That's the P. So, what are we going to put the patient on some kind of medication? Are we going to refer them out? And teaching is also in the plan. So, our patient teaching goes there. That's part of being a provider, doesn't just end with the decision making of what the disease process is. We need to come up with a treatment plan. So this week, I really want you to focus on that because from here forward, when you're writing notes, and you're going to be doing this in your next course, I think you're taking physical assessment next. You're jumping right in to do this. So you're going to have one up if you have done a note here. You'll have a greater understanding of what the expectation is when you move into physical assessment. So, again, if you have any questions, please reach out. Otherwise, I'll see you in the posts.